Systems Project Waitrose France. France uses a statutory or social health insurance system. What that means is their healthcare coverage is funded by taxes and payroll contributions, and everyone in the country is automatically covered. In France, the healthcare is seen as more of a public service, so everyone puts in and then everyone also benefits. The system covers a lot of benefits like hospital care, doctor's visits, long-term care, and it also covers dental, hearing, and vision. In addition, supplemental coverage is available. Some people get them through their employers to help with copays or extra costs that the main insurance doesn't fully cover.
Okay, so public health insurance is mostly financed by payroll taxes that cover 53% of it. And employers are paying a majority of this. And then the rest of it comes from income taxes and then taxes on tobacco, alcohol, pharmaceuticals, voluntary health insurance companies, and state subsidies. And then private health insurance is mostly voluntary health insurance companies that are complementary and employment based. Complementary basically just means that it helps decrease the amount of out of pocket costs for patients. And then this is just financed through co-insurance, co-payments, and balance billing.
So after reviewing financing, we can see that France's healthcare system has various standards in place to ensure affordability for citizens, while also including options for additional insurance. Since the public insurance is funded through tax and state subsidies, as said, about 77% of French healthcare costs, including general practitioners, hospitals, dentists, and pharmaceutical costs, are covered by the government. Seniors over 65 and those dealing with chronic illnesses get their costs covered in full. To cover the remaining costs, complementary private insurance called Mutuelle helps to do so. If there are co-pays on a bill, they have a fixed cap of around 50 euros. For cost containment, there are two examples of policies in place to ensure that no exorbitant costs for patients. So one is that National Health Expenditure Target, and it's voted each year by French Parliament as a part of their Social Security law. And it's a tool for managing healthcare expenditures so they make sure to set budgets and encourage cost-saving measures while maintaining the public insurance in the country. And then secondly, the Economic Committee for Health Products, it helps negotiate and set the prices of medicines and certain medical devices that are covered under public insurance. Drugs are authorized, assessed for their medical benefit, and given a set maximum price that manufacturers charge. And there's a mechanism called the safeguard clause. So if the drug spending the pharmaceutical companies exceeds a threshold, the national budget, the companies must rebate their revenue or pay back the state. So France does a lot of work to ensure affordability for its citizens.
So there's also a lot of things that France does to keep their quality of care pretty high. The physicians receive additional payments for achieving certain goals in their practice. So this could be things like using computerized medical charts, prescribing generic drugs instead of the name brand, delivering immunizations, things like that. And then there's also national programs that help treat and prevent chronic illnesses, as well as give benefit packages to those who are already diagnosed. So these just help to advance treatment strategies, educate citizens on prevention, and give guidance to patients on the best ways to go about their care. There's continuing education for most providers, and then healthcare facilities are also accredited nationally. So just to kind of compare like the quality of care, like kind of like our lifespan, how healthy America is versus France. Um, According to the World Health Organization, the average life expectancy in France is 81.9 years, which is a lot higher than the US. We're at 76.4 years. And then heart disease and COVID-19 are the two leading causes of death here and in France, but their death rates are still a lot lower than ours.
All right, so how do providers play into the system? So, in terms of medical education, their education is virtually free compared to the US, and they have to pay very little for it, including both medical school and any malpractice insurance. But in terms of US money, they only get paid about 50 to $65,000 per year, so much less than the US physician would. But they do not have to worry about as much paperwork due to something called the Carte Vitale system in France, which is basically like a little credit card that anyone above the age of 15 has. And when they go to like a hospital or health facility, the provider will scan it or just swipe it, and it basically tells them all of their health history from like when they were born to the present. So no paperwork really needed for that. And then also, they do not face immense pressure from insurance companies like providers do in the US. So overall, French physicians, despite these lower incomes, they're typically okay with them because they have these better working conditions, including less stress from insurance companies and less having to deal with the paperwork and just the medical freedom that comes with getting to choose how they want to treat their patients. However, they can become dissatisfied when attempts are made by the sickness funds, which are basically what Maddie mentioned earlier, predominantly are funded by income and payroll taxes. Those are collected and they are what fund the insurance primarily to cover costs. And these can become depleted when like older populations or those who are unemployed take part in insurance. Since everybody is required to be insured, they can deplete those funds because they are not employed. So the first thing that these sickness funds do to make up for those costs is they start with provider paychecks and they um, start cutting from these providers' paychecks first, which can obviously make these providers very unhappy. And this leads to frequent strikes and lobbying attempts by these physicians.
Okay, so policies, and we're going to just discuss the current French policies and how the US could eventually adopt them, maybe. So this first policy called Loi de Santé Publique, or the Public Health Act, was introduced in 2004 as a 5-year plan that set the framework for the country to address public health concerns and improve population health. As the slide says, it had around 100 measurable objectives to improve population health, prevent risk factors, address disease, protect mothers, and manage occupational risk. And its intention was to help shift the focus to a preventive population-based approach to care. France had various public health policies in practice already, but this act was helped establish some things as well. And even after the 5-year threshold, we see that it's already past 2009. The details in the law do impact their current code of public health, which is actively being amended. And especially with the creation of their Health Policy Council Board, which helps regulating and establishing public health policies currently. And it's clearly beneficial to have a plan to set these clear goals in the nation to address issues like this because it gives the government a standard to reach for systemic inequities and the root causes of health issues. And so the US can benefit from an act like this because it emphasizes the health in all policies approach. So it allows us to address various systemic barriers that inhibit most of the citizens from receiving adequate health. And so if we were to have like a national public health act, we would be able to address these food insecurity and occupational health and gerrymandering and things like that. So it can ultimately lead to improved population wellness.
All right, so the second policy we looked at was a mental health reform, which I'm not even going to try to pronounce what it says in French, but they implemented this new program at the beginning of 2025. And in short, it's the MONSI program. And it had a goal of addressing mental health issues by increasing the number of fully reimbursed psychological support sessions from 8 to 12. So basically, this just allowed citizens extra access to therapy without needing a referral from a doctor. And it was practically free because it was fully reimbursed. So obviously, the strengths of this are that without the need of a referral or payment, that these barriers toward individuals seeking mental help were reduced. And then it also emphasized early prevention. So this in turn could deter worse health issues later on in these people's lives. And then for the US, it could certainly benefit us because ever since the pandemic, poor mental health rates have been increasing. So this just makes it that much more crucial that we implement more easily accessible services like the ones that this reform offers in the US.
All right, so Protection Universal Maldi or PUMA is basically the universal healthcare like system. So, ever since January 1st, 2016, it guaranteed automatic and continuous coverage for all legal residents of France. Before this policy, people would have to switch their insurance based on like if they like got married, if they moved, or if they got a new job. So one of the strengths is that people can keep this insurance whether their life change. The sign up process is easy. There's like little to no paperwork, and then it also helps ensure that everyone has fair access to care. The way that the US can benefit is it can lower the number of uninsured people and can also reduce the medical debt that a lot of Americans have.
All right, and our final policy addresses long-term care and aging. So it is known as the Great Age and Autonomy Plan. And this policy attempts to address challenges that come with an aging population. And they address these complications by expanding home care options, increasing support toward caregivers, and reforming their previous institutions to make elder care more person-centered rather than the facility-centered approaches. So the strengths that come with this reform is that it allows older individuals to have more autonomy in their care, and they get to choose if they want to stay in their homes longer, which also increases their dignity. And then it also helps prevent burnout among caregivers because this reform requires that these caregivers are offered more financial assistance. And this could certainly benefit the US because we rely heavily on nursing home facilities, and these are very costly services. So it could certainly reduce these costs. And then also, it could improve the morale among our older populations just because they get the choice to stay at home rather than um, be moved to these other facilities.
Okay, that's it. Thank you.
Thank you.